There we go. I'm Berks County Commissioner Christian Leinbach, and I want to welcome everyone to our Commissioners Board meeting for June the 23rd. We're broadcasting live on Microsoft Teams live event, as well as BCTV, YouTube, and Facebook Live. At this time, I'd like to begin with a moment of silence, followed by a pledge to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This morning, we're going to begin with a public hearing. This is held for the approval of the Human Services Block Grant for fiscal year 2022-2023. For the Mental Health and Developmental Disabilities Department and Programs. And at this time, I'd like to recognize our Director of MHDD, Pamela Seaman.
Here or at the podium, Ms. Penner?
Wherever you.
Okay, here, stand. Good morning, as Commissioner Leinbach.
Yeah.
Oh. Can you hear me? I'm Pam Seaman. I'm the MHDD Program Administrator, and thank you for having us today to talk about our Human Services Block Grant. This is our public planning process that we do on an annual basis. Our Human Services Block Grants funds are a combination of several different sources. Next slide, please. It's our mental health community-based funded services, our BHSI initiative, intellectual disabilities, Act 152 drug and alcohol services, homeless assistance program funding, and human service development funding. And since 2012, Berks County has been a county that is block grant funded, which allows us to have some flexibility in terms of spending. And Stan Papademetrio is also here from the Drug and Alcohol SC Council on Chemical Abuse, and he is a partner in this planning process with us as well. So as many people know, fiscal year 2021 and 22 has been quite difficult for all of us because of the pandemic. There's been a lot of flexibility that's been allowed in different service delivery sectors with regard to regulations, but again, as we expect, all of those will be coming to an end with the public emergency being closed down. One of the things that I'd like to recognize in this process is our providers have been tremendously flexible, adaptive, creative, have tried all different innovative ways to try to support people throughout this pandemic crisis. Again, lots of our services were delivered in different ways than we had done prior to the pandemic, which was via telehealth, or again, a variety of both in-person and virtual platforms. Our developmental disability services also were greatly impacted by reduced censuses in our day programs, by residential providers, and across the board, just really difficult times in terms of staffing. Next slide. One of the things that also happened was the state actually was very creative and approved lots of different ways to lift restrictions, also to encourage our funding streams, including our Health Choices program to allow for alternative payment arrangements to keep our providers whole and to keep our services functional and up and running and prevent providers from going out of business. Other things that were happening as a result of the pandemic that influenced what we do were things like ERAP, which provided emergency housing assistance and rental assistance. So one of the things that happened with the availability of ERAP funding is the way that we used our homeless assistance program funds changed, because ERAP funding was a lot more flexible than the HAP funding that we had. So we worked together with the ERAP programs to try to figure out how to best use those dollars. Some of the other things that happened during COVID were we received some additional allocations from the Developmental Disabilities Program for administration, and we also applied for and received federal funding from the Office of Mental Health and Substance Abuse Services for the startup of crisis residential program, which I'll talk about in a little bit. Next slide. So with regard to our block grant implementation, there's a consolidated planning process, and that's why we're here today. We collect information all year long about the service needs of the people that we support, and we try to figure out where we best spend our dollars, how we utilize those, how to focus things. So we have a leadership team that includes members from the Single County Authority, Stan and his organization, our developmental disability community, the mental health community, our Health Choices program, and the homeless assistance program. One of the things that I always like to highlight is, we never like to return money, and it's hard to believe, why would we have excess money at the end of the year? But especially during the pandemic, one of the things that we saw is the number of individuals who tried to access service or the services that they could access were diminished. So, we did have some funding in the past last year, and we will likely have some funding this year. One of the things that I also like to highlight as part of this piece of the conversation is we do receive our allocation letters from the state very late, sometimes 6 months, sometimes 7 months into the year. So it's really hard to not be fiscally conservative when you don't really know what your resources are going to be. Next slide. So the people that we've served, our mental health funds, and I'm not going to read all the different services that are supported by these areas, but there's lots of different services on the mental health, on the developmental disability side, and the number of people that we served last year on the mental health side were 7,627, and on the developmental disability side, 1,295. Next slide. The Human Services Development Fund, which comes to the county, it's a much smaller amount that we receive, about $322,000 in 21-22, and there are very specific areas that you can use the funding for, and those are indicated on this slide as well. Next slide. Our homeless assistance program funding, again, a small amount of money, but it goes towards bridge housing, rental assistance, and case management. And as I indicated, with the ERAP funding that was available, we've worked closely with KenPIC and others from the county to make sure that the funds that we do have available are being used where they're most needed. And for this past year, it was focused on helping to house homeless families in hotels so we can help them get some other more permanent living situation. Next slide. I'm going to turn this part over to Stan on the drug and alcohol.
Thank you. Good morning, Commissioners.
Good morning.
First, I'd like to thank Pam for including me in this presentation today, as well as the public meeting we had yesterday, and I really appreciate the collaboration and working relationship we have with MHDD. Especially since a lot of the folks we serve cross over into both systems. I also want to appreciate the Human Services Block Grant. Commissioner Leinbach and Barnhart, you were there 10, 11 years ago when all these things were happening, and there was a lot of concern, especially from the drug and alcohol system, that we would get lost. And that if everyone got to get a piece, if it came in one big pie and everyone got to grab what they wanted, that drug and alcohol would be left out in the cold. And our experience over the past 10 years has been anything but that.
And Stan, I'll add to that. You remember George Vogel was almost a lone voice, your predecessor, because throughout the Commonwealth, single county authorities were largely opposed to the Community Human Services Block Grant. George Vogel not only raised his hand, he went with me to Harrisburg and advocated that counties knew better how to allocate these dollars. And it's been proven. Your organization has been a great partner. And I know Pam has been through that entire period, not in the exact role you're in today. But yes, it has worked, and we're proud of what counties, and it's not county commissioners, it's leaders like you and Pam and others in the human service side of county government that have done the right things with the money and protected taxpayer dollars.
Quite honestly, it's much better to get the money this way than the silos we had been getting it in before, because it does offer us a little bit more flexibility in terms of moving money from one area to another. So that's very helpful, because year to year, we're not sure where the need is going to be greater. So the Human Services Block Grant funds are really important to us because it really helps fund the continuum of drug and alcohol services all the way from prevention, intervention, treatment, recovery supports, recovery housing. So those funds are extremely important to us. The numbers are there, as you see. As Pam had mentioned, I'll echo that the last year or two since the pandemic, there's been a little bit of a slowdown in terms of folks kind of knocking on the door, if you will. But we've also been dealing with the COVID as well as Medicaid expansion, and we know we believe firmly that when the medication expansion begins to contract, there'll be more people in need of the safety net than are taking advantage of it right now. I told Pam I would just take a couple minutes, but I need to say that the issue still in this county is overdose deaths, and the carnage of that. In 2021, there were, now the number is 144 overdose deaths confirmed by the coroner. Commissioner Barnhart sits on the Opioid Coalition, and he sees the numbers as well as I do. And right now, they're projecting to smash last year's number. In 2020, I said that was the biggest year. In 2019, I said that was the biggest year. I'm afraid if the trend continues, 2022 is going to be the biggest year. So we need to continue to do those efforts, and the Human Services Block Grant funds help us with that. We're able to this year quadruple the number of Narcan kits that we get out onto the street. And it's important for Narcan to be out there. Narcan is not a cure for heroin addiction or an opioid use disorder, but what it does, it's an antidote for an opioid overdose. And we can't treat somebody if they're not alive. So getting Narcan out there in the street is extremely important. We've done much better this year. We intend to increase that by much more next year. And then some of the other programs that this helps funds, like the Blue Cares program, where we have police officers and a recovery specialist visit someone who's an overdose survivor that the police help revive and go and do an intervention with them. So those are all important services that come from the Human Services Block Grant. Again, we appreciate the opportunity to work with Pam and the county in developing a plan on how best to serve the community. So with that, I'll hand it back over to Pam.
Okay, next slide. I think he already addressed this. Again, I talked at the beginning about how the block grant allows us some flexibility. So this year we did actually move a little money from MHD-DD to the HSDF categorical. Next slide. Retained earnings. So that's what I was talking about. We have a little bit of money left over at the end of the year that the state will allow us to put back into our programming. It's usually for one-time only money, so we can't start new programs that we're not able to continue and maintain. So for last year, the areas that we actually focused our retained earning funding on was housing, rental, and utility assistance. And I like to talk a lot about, our program funds and supports people in terms of treatment and service needs. But a lot of times what we see going on is people are struggling in other areas. Their basic needs aren't being met. They don't have a place to live, especially since the pandemic. One of the things that we've noticed is that rent amounts are going up astronomically, and the people that we support who are on very limited incomes can't afford that. So we'll help with first-time rental deposits, utility assistance, getting things turned on, etc. The Lost Team, we're really excited. This is a new partnership that we have with the Greater Reading Mental Health Alliance, and that's to support family members, friends, people who have been involved with the loss of a family member or a loved one, someone they care about related to suicide. So we used our money to support grandma and having 2 of their staff receive training on developing a Lost Team, and more to come on that this year as we hope to build that. The other thing that we focus some money on is our forensic apartment project. Again, these are diversion apartments that we use to try to keep people with serious mental illness out of jail, or if they're in jail, to get them back into the community quicker. We actually use this these resource dollars to have a provider that we partner with, Berks Counseling Center, buy a building. And then other things that we used our retained earnings for this year are just anything really related to suicide prevention activities and anti-stigma events related to mental illness. Next slide. So this is the part that I'll slow down and I like to highlight. And these are the things that the state actually identified, and we identified as strengths in our plan that we submitted last year. And that's that we have a comprehensive and well-funded housing plan. We do have a pretty comprehensive continuum of service. We focus a lot on transition age care for use. And you'll hear me talk about this in a minute. Also, you know, this year, anywhere that you go, anywhere you read, you see a focus on youth mental health. One of the things that we're pretty proud of is that we have outpatient mental health services in all of our school districts and in community college and in buildings. And then MAT access, opioid task force, et cetera. Some of the things that we identified as needs last year were supported housing services, and I am happy to say that we were able to issue an RFP and get those up and running this year. Extended acute services are services that are a step in between an inpatient psychiatric facility and long-term state hospital placement, and we still have a need for that, and we're still trying to find community partners who are willing to work with us on that. Additional Medicare providers and expansion of service providers for co-occurring disorders. So some of the things for, especially related to planning and where we go next, are forward considerations, ideas that we have about program gaps and services. And as I just mentioned, especially with kids, and especially with the pandemic, we know a lot of kids came back to school after being out for 2 years. They've really struggled with the transition. You have kids who normally may have been in elementary school and now transition to middle school or junior high, and it's been a rough transition because developmentally they're sort of stuck back where they were 2 years ago. So we've been working and partnering with the IU and other school districts to figure out how else can we support what's going on? How can we support the needs of the kids? The other thing that I would also say is that we've been very focused on our emergency departments because we have seen a lot of individuals turn to the emergency rooms either because they delayed care or they tried to get care and they couldn't get the care that they wanted. So we've been working closely with them to try to either have them not go to the emergency room at all or help the emergency room get them out quickly and into services that they need. So I mentioned earlier that we received funding for crisis residential services. That is a service that we currently don't have and that we're just starting up. Holcomb is the provider that responded and was awarded the RFP that we issued in collaboration with our managed care partner, Community Care Behavioral Health. That will allow us to help individuals who need something more than outpatient services or a partial program, but it's less acute than an inpatient setting. So basically we'll be able to provide crisis services for individuals up to 14 days, and we'll be able to support 6 people in that setting at any given time. Other things, and I have highlighted here the state budget restoration of 10% cuts, and that's really important to us. About 10 years ago, the state across the board cut all county mental health based funded programs. And those dollars are especially important for us because we support people that don't have insurance or underinsured, need treatment, and they also support services that aren't treatment in nature. For example, our supported living services or anything that's residential. Again, that's a bigger part of everything that we do to support people with mental health. It's just not treatment. They need lots of services and support. So we welcome any public comment. We welcome any consideration of other things that we haven't identified as a service gap that we need to continue as we look into this next year. And if anyone has any questions on my presentation or has any comments that they'd like to add in terms of our public planning process, thoughts, ideas, or services that we should consider. Appreciate your having us here today.
Thank you very much, Pam. We do not have any in-person comments. There are no online comments. Any Comments from my colleagues?
I do. For our sake and the sake of our viewers, could you both, Stan and Pam, recap what efforts both of your agencies do on behalf of the jail and what services you provide at the jail? As we move forward to the jail and converting to a facility down the road, I'd like the public to know what services we have that are being provided to the folks at the jail.
Sure. We work in collaboration with the jail all the time to talk about individuals who are there, who are identified as part of their initial screening process that might have a mental illness or actually a developmental disability as well. And then we work closely with the team at the jail, the deputy warden, with the treatment providers, and we have forensic diversion specialists and forensic case managers who will actually work with those individuals to try to develop plans. We'll work with the district attorney's office and the public defender's office to come up with a plan for a discharge into the community that will be safe and hopefully will maintain that person. But more importantly, we also try to divert people from ever getting to that standpoint. If people are taken to central processing and booked and again may become part of on our screen or someone that we're aware of, we'll also follow them through so that when they are admitted to the jail, if there's information that we know that would be helpful in terms of continuity of care, that we work through all of that. And of course, we have our Stepping Up initiative, which is very focused on keeping people with mental illness out of jail and using data to actually make decisions, guide policy, and we're excited to have that up and running and actually at a place where we can start using that data, looking at things like recidivism, length of stay in the jail, continuity of care, connections to care when people leave, what's working, what's not working. So those are some of our efforts on the mental health side.
Thank you very much.
So on the drug and alcohol side, historically, we've been up at the jail providing screening and assessment to identify individuals who might have a substance use disorder and provide licensed drug and alcohol treatment through a contractor that we choose in conjunction with the jail to go up there. Now, during COVID, it became very difficult to do those in-person services, so we had to do a little bit of a pivot, and there was more kind of individualized things that the inmates up there could do in their cells. But now, as the thaw, so to speak, of COVID is coming, we look to get back in there and do those treatment services. On top of that, we also have a project called the MA Jail Project, where we evaluate some individuals who are incarcerated. We sign them up for medical assistance so that the moment they walk out the door of the jail, they have medical assistance and they are transported right to a residential drug and alcohol treatment facility. So it's door to door. And what that does is it gets somebody right into treatment from jail, but it also helps reduce jail days because they're spending time in treatment. And then the third thing is we have a program where folks are initiated onto a medication-assisted treatment prior to leaving the jail, so that when they come into the community, they're already engaged in this, and we have kind of a running start, so to speak, with these folks as they come back into the community.
Thank you very much. Appreciate the information.
I just want to take a moment to thank you, Pam, and Stan, for the work that you do with mental health and drug addiction. It's not easy. There's a lot of need, especially right now, for mental health issues. One of the things that the County Commissioners Association of Pennsylvania is pushing is for more mental health funding at the state level. Something that we're also pushing for is that money comes to the counties, and the county then determine where that money goes rather than the state determining where the money goes, because it's the counties who at the local level know which is the best use for those dollars. So thank you for your support of that as well, Pam, and trying to make sure that the state money that does come will come through the counties. So at the local level, we can make the best decision for each of the counties.
Yes, thank you very much. There are a number of folks here too. I know from your teams, from Human Service. I see Jessica Jones from our Area Agency on Aging. We all work together, or all of these departments work together in cooperation. And again, I cannot highlight enough that it is the people here in the audience that do this hard work every single day, and we very much appreciate all of the work that you do. Thank you. At this time, I would entertain a motion to adopt 205.2022.
And to close the public hearing.
And to close the, well, let's
Sure.
close the public hearing. A motion to close the public hearing.
So
Motion to
moved.
close. Second.
The hearing is closed. Motion on the resolution.
So moved.
The motion has been made and seconded. Is there any discussion? Hearing none, all those in favor signify by saying aye. Aye. Opposed? The motion is carried. Thank you very much. We'll move now to a second presentation. This is from Peter Edelman, Stevens and Lee, and regarding your bond counsel for Albright College.
Thank you. Good morning, Commissioners. Yes, I am here on behalf of Albright College today. They are moving forward with a tax-exempt financing through the Berks County Municipal Authority. The resolution before the board is the standard project approval resolution that we've discussed on many occasions for other not-for-profit organizations here in Berks County. Albright College involves the restructuring of some existing debt, as well as financing some capital improvement projects on campus. The most prominent being the new esports facility that you probably read about in the newspaper that they're moving forward with, and which has garnered quite a lot of interest from new students making applications to the college, and as well as computer science majors who are pursuing degrees at the college. So the project entails up to $75 million of outstanding bonds, which includes refinancing all of their existing debt, as well as new projects that I discussed, and some working capital on behalf of the college. The resolution does make clear that this is simply an approval of the project, and the county is in no way financially liable on this debt. Again, it's just a precondition required by the Internal Revenue Code of 1986.
Absolutely, and again, good project for a community, and hurry in and before the interest rates go up again to do any refinancing.
Right.
Do I have a motion on 205? I actually did the wrong number the last time. No one caught that.
Motion to approve the resolution for the taxes and bonds for Albright College through the Berks County Municipal Authority.
Second, just for the record, I think earlier I said 205 and I meant 205.2021. So just
No, that was the first.
and that should say 22. I know that, but I think I was already down to the next one. So just clarify. The motion's been made and seconded on 205.2022. Is there any discussion? Hearing none. All those in favor signify by saying aye. Aye. Opposed? The motion is carried.
Thank you.
Thank you very
Thank
much,
you.
Peter. Are there any additions or corrections for the June 16th Commissioner meeting minutes? Hearing none, the minutes will stand approved as presented. We did have several executive sessions on June 20th. We had an executive session on personnel. Also on June 20th, we had another executive session dealing with personnel, real estate, and litigation. On June 21st, we had an executive session on litigation. And yesterday, June 22nd, we had an executive session on personnel, litigation, contract negotiations, and real estate. At this time, I'd like to recognize my executive assistant, Anne Marie Grill.
Thank you, Commissioner Leinbach. Public comment will be accepted in person and through the Q&A function. Please include your first name, last name, and municipality for all comments. Any comment without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used: Teams, Q&A, Facebook, and YouTube. In-person comments will be accepted first, followed by comments submitted virtually. The meeting comment period is limited to a total of 30 minutes, including both in-person and virtual comments. This time period may be extended at the discretion of the board. Please be concise. Comments that are germane to county business will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. The county solicitor shall be the final arbiter of whether a comment is germane and should be read. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you very much, Anne Marie. There is no public comment at all because the next item is public comment on agenda items, nothing in person and nothing online.
Mr. Chairman, I'd like to make a motion to approve the agenda as presented for time's sake.
And I will second that.
The motion has been made and seconded. Just for clarification, people may wonder why. Some of us are going to be down at an event with the Tri-County Chamber of Commerce where Berks County is being honored as one of the 3 counties involved in the formation of the Schuylkill River Passenger Rail Authority. That event starts at 11:30 and it's a 45-minute drive. So that's the purpose for this motion. Any other discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The motion is carried. With that, we will go to reports. First of all, we'll go to our county treasurer, and we have Linda Weaver here, the deputy treasurer, with the treasurer's report. Linda.
Good morning.
Good morning.
We have an opening balance of $259,994,776.55. We have a balance to clear of $4,292,987.76, leaving us with a balance of $248,701,788.79.
Thank you very much, Linda. And we'll now turn to our county controller, Sandy Graffius, with the controller's report.
Good morning.
Good morning.
Have total accounts payable of $5,017,712.31. We had a payroll this week. $4,714,876.60 for a grand total of $9,732,588.94. Congratulations on our award.
Thank you very much, Sandy. We'll move now to our county chief administrative officer, Ron Seaman.
Thank you, Commissioner. I have nothing to report at this time.
Thank you. With that, we'll move to commissioners' reports, and we'll begin with Commissioner Michael Rivera.
Thank you, Commissioner Leinbach. I just have a few items I'd like to bring up. Just wanted to let you know that this past week, I was not here. I was in Washington, D.C., participating of the 2022 National Association of Counties County Leadership Institute, which is a great opportunity. It was from Sunday to Thursday. It's one person is nominated from each state association. I was nominated by the County Commissioners Association of Pennsylvania to participate. There were 14 of us in the institute. Furthest one away was in Washington State, not Washington, D.C. So it was a great opportunity to have some learning during that week, looking inward at yourself. As they said, standing on the balcony and looking at the dance floor from a different position. So I was fortunate. So I want to thank my colleagues for supporting me in taking this Leadership Institute in last week. Also, this past Saturday, I was able to participate together with Commissioner Barnhart at the Safe Berks Celebration of Peace and Walk for No More, where Safe Berks is for women that suffer from domestic violence. So I just want to take the opportunity to let everyone know that domestic violence is not something that is acceptable. When you talk about domestic violence, it's not just about physical violence, but there's a lot of other things that are involved in there: mental, emotional, financial, and many other involved in there. So if you do know of someone that is going through that, please have them reach out and seek help. It's not something that they have to live with. There is help out there for them. The other thing I want to also let people know about is the 2022 Barnopoly was kicked off this past week as well, and it runs through August the 20th. I will have more information on that next Thursday, but Barnopoly You can Google it and find out more information. It's basically a way of getting people to use our local small businesses in the ag industry related some way to ag industry. You go, you visit different ones, you fill out a Monopoly, sort of like a Monopoly card, and then you're entered to win some prizes at the end. So it was really, really good opportunity to get to know our local small businesses and primarily those in the ag industry. Again, I'll have more information on that next week. And also want to congratulate the Reading Berks Association of Realtors. Last night, they celebrated their centennial gala. So they are celebrating 100 years of service to the Reading and Berks community. So congratulations to them. That's all I have. Thank you.
Thank you. Commissioner Barnard.
Thank you, Commissioner Lineback. Usually I try to find positive things to discuss, but I have two somber notes today. As we are here meeting, services are being held for Council President Jeffrey Waltman. I was able to represent the board last night at his viewing at Coon Funeral Home and came to find a real family man, really dedicated to his children and his grandchildren. He'll definitely be sorely missed. His daughter said every morning, like clockwork, he'd make sure that kids got to school so she could get to work. So you talk about, losing people so early in life and how they pick up their pieces and move on. It's tragic. But my time and experience with Jeff, I'll tell you, a guy that really could try to bring people together and foster support for the community and really move things forward. He was quite a heck of a guy. He's going to be really, really seriously hard to replace on city council. So my thoughts and prayers are with the family of Jeffrey Waltman. And we lost a pioneer in parks and recreation, Bill Semmel, worked for us for over 40 years. He was the leader, the first director of the Parks and Recreation Department, and created numerous parks through his 40 plus years here. And there is a celebration of his life Saturday at Grings Mill at 11 a.m. I think it's 10 or 11 a.m.
I think it's 10.
I think it's 10 to 11.
Yep.
So, Bill, we wouldn't have the park system that we have today here in Berks County if it wasn't for the vision of Bill Semmel and, of course, the folks who supported him, whether it was commissioners or his staff. There is a plaque in his honor at Grings Mill, and I think we dedicated that a few years ago.
Yes, we did.
And I believe that's where the event's going to be on Saturday. So it just seems like as we get older, we start to lose cherished people in our community that you just look back and say, wow, we are where we are today in Reading and Berks County because of leaders like Jeff Waltman and Bill Semmel. Thank you.
Thank you very much, Commissioner. My sympathy as well to the family of Jeff Waltman. And I think in an era of politics that is personal and at times very caustic, Jeff was the epitome of a leader that didn't let things become personal. He kept things on an even keel, even when he disagreed with people. And I think that's what we need today. My wife and I talk about this often. It is possible to be courageous and kind. It's possible to be strong and humble. And I think Jeff exemplified that. Secondly, I will be at the memorial service this Saturday for Bill Semmel. Bill spent over 40 years of his life leading the park system here in Berks County. In many respects, this was his life. Several years ago, and the pandemic always throws me off, but we were able to participate in the placing of a plaque in Bill's honor right next to the barn at Grings Mill. I am so glad we were able to do that while he was alive, while he was able to understand how appreciated he was and is. And I don't know this for certain, but all the family was there for that event. I've got to believe that when they thought, where do we want to have a memorial service, they were drawn to the parks and specifically to that location. I was going to be participating in the Thin Blue Line Heroes Ride, a classic Harley, in honor of Berks County Deputy Sheriff Kyle Pagerly and former Reading police officer Scott Wirtz, but it's at the exact same time. And that's both of these are somber events, but I really felt I needed to be with the Semmel family. But I want to encourage people, if you don't ride motorcycles, you can still go from 10 till noon. The cycles pull out at noon. I don't know the exact route. They're ending up at Klingers at the airport. I'm fairly certain they're not driving right from Classic Harley to Klingers, because that would be about a 5-minute ride. So I don't know the route, but you can, if you don't ride, you can show up, you can buy your lunch there, you can support the effort. I would encourage you to do that. The last item I want to touch on, we just passed June 19th. Juneteenth is what it's known as, and I felt it was necessary to briefly explain why this date is important. Most Americans, until recently, had no idea what Juneteenth was. I am a student of history. I have a degree in history. I love history, American primarily, but world history overall. I have to admit, I did not know what Juneteenth was until a number of years ago when I met with Frank, the late Frank Gilliard, and his wife Mildred, and they met in my office and they mentioned Juneteenth, and I was, what? Juneteenth? Well, I had no idea what it was. And I learned how important it is. June 19th, 1865 was the official end of the Civil War. And most people learned that the Civil War ended in April of 1865 at Appomattox, with the signing, or the surrender, if you will, of General Robert E. Lee to the commander of Union forces, General Ulysses S. Grant. And yes, the document was signed, but the war wasn't over. The word didn't get to Galveston, Texas until June 19th. Why is that important? Well, there's a little document called the Emancipation Proclamation. And most of us don't realize that was an executive order. So it only had the power of President Abraham Lincoln. If the Union had lost the Civil War, it is most likely that the Confederacy would have immediately done away with the Emancipation Proclamation, the same way we see today when parties change. That one of the first things they tend to do is go in and get rid of the executive orders they didn't like from their predecessor. Believe me, June 19th is significant. It's when the war ended. It's when emancipation became, in essence, the law of the land. And this event is something that is not new. It was first celebrated in Texas in 1866. It expanded not just in Texas, but beyond. There's actually a celebration in Mexico. Why? Because in 1852, a group known as Black Seminoles escaped slavery in Texas and settled in Mexico, and there is a major celebration of Juneteenth. I share that so that we don't get caught up in the politics of the day, and part of that involves sound bites and not doing your homework and looking at what something is really about. Juneteenth is a celebration of the end of the Civil War. Juneteenth is a celebration of the end of slavery as they knew it at that time. And one other thing happened between Appomattox and June 19th, and we don't think about it. Abraham Lincoln was assassinated. The Union was in turmoil. Yet June 19th came, and the South ultimately, in Texas, surrendered, and emancipation became the law of the land. So hopefully that is helpful information about Juneteenth. That's all that I have. Are there any comments from our row officers? Yes, Carmen.
We can please remind the viewers of our on-the-road meeting next week.
Yes, we should announce that. Next Thursday, June the 30th, we will be at Cumru Township, in the Cumru Township building for a 7 p.m. Commissioners on the Road meeting. That will both be in person as well as virtually. Please plan to either attend in person or virtually. If you want more information, go to countyofberks.com, click on public meetings. There's information there, and within no less than 24 hours, an agenda will be posted 24 hours prior to that meeting. So Carmen, thank you very much. June 30th, Thursday, 7 p.m. At the Cumru Township building. There's no public comment online and no public comment in person. I'll accept a motion to adjourn. So moved.
Second?
The meeting is adjourned.